Hi, welcome to Chapter 11, the cardiovascular system for medical terminology. Just some fun facts about the cardio system. I like to start the lecture with something to get your attention. So the first blood transfusion was performed in 1818 by a British obstetrician. A husband gave blood to save his wife, who was hemorrhaging and near death after giving birth. He didn't know if they were compatible. He didn't know that that would even be an issue, but he saved her life and also saved many lives because now we can do blood transfusion thanks to this physician. So the cardiovascular system starts on page 400 in your textbook. Introduction is the previous body systems we have discussed so far all depend on a constant supply of nutrients and oxygen in order to function. And the cardiovascular system is what does all of this important work. And we will talk about terminology related to the heart, including the vessels, capillaries, arteries, and veins. Those are the types of blood vessels in the circulation of blood. They are arteries, which are the biggest and the strongest, capillaries, which are the smallest, and veins, which fall somewhere in the middle of those two. All of these vessels, whether it's the arteries, capillaries, or veins, are lined with an endothelial cell, and these cells are responsible for secreting factors that affect the size of the vessel for constriction and dilation, and also reduce clotting and promote the growth of new vessels when necessary. The first one we'll talk about, the first of the three vessels, is the artery. And if you look on page 401 in your book, they give a side view with the different layers of each vessel, and then a view of us looking into that vessel. And the first one on the top is the artery. This is the large blood vessels that lead away from the heart. Arteries always lead away from the heart. A good way to remember that is to think of artery starts with the letter A, and the word away starts with the letter A. Arteries always lead away from the heart. The walls are made of connective tissue, muscle tissue, elastic fibers, and then epithelial cells. They have to be strong enough to withstand the high pressure of the pumping action of the heart. That's why the artery is the thickest. The elastic walls allow them to expand as the heartbeat forces blood into the arterial system with great strength throughout the body. If we look at that picture on 401, we have the outer layer, the muscle layer, and you can see that muscle tissue. The elastic layer, which this is the only vessel that has elastic layers. The inner layer, and then the endothelium, which is the inner lining, and that's what secretes chemicals to dilate and constrict as needed. Smaller branches of the arteries are called arterioles, and if you break that word down, O-L-E means little or small, and then artery means artery, so small arteries. Arterioles are thinner than arteries and carry blood to the tiniest of blood vessels, and the smallest blood vessels we have are the capillaries. And they're down at the bottom of the picture on page 401. They're very simple compared to the arteries. These are only one cell thick. Because they are so thin, oxygen and nutrients can go into and out of the capillaries very easily. Nutrient-rich oxygenated blood cells from the arteries go into the body cells, and the nutrients and the waste products come out of the cells through the capillaries. At the same time, waste products pass out of the cells, and the waste-filled blood flow back to the heart in small veins called venules. U-L-E, like O-L-E, the suffix means little or small. And venules branch into form larger vessels, veins. And vein is the middle picture on page 401. Veins are thinner than arteries, but they're thicker than capillaries. They carry blood back into the heart. If you look at the word vein, the word in is in the word vein, and it's carrying blood back into the heart. So veins always carry blood into the heart. There is very little elastic tissue and less connective tissue than arteries. The pressure in the vein is a lot weaker than the pressure in arteries, so it doesn't need to have elastic tissue to withstand high pressure from the pumping of the heart directly. Veins have valves. Veins are the only vessels with valves, and valves are responsible for preventing the backflow of blood and help keep the blood moving in one direction. The circulation of blood goes from the arteries, we're going from the heart, to arterioles, to veins, venules, capillaries, and the heart. All of these form the circulatory system. And if you look on page 401 at the bottom, they have the relationship and the characteristic of the blood vessels and how they work together with the organ, the heart. The blood that is rich in oxygen is colored red. The blood that is poor in oxygen is colored blue. So you can see as it leaves the heart through the arteries, it's oxygen rich. And when it gets to the tissue capillaries, that's where the exchange of oxygen and carbon dioxide takes place. That is where the blood goes from red to blue. It travels back to the heart through the veins when it's oxygen poor to get oxygen rich again. The flow of blood through the heart. So oxygen poor blood enters the right side of the heart and travels to the pulmonary artery, and we'll label it this diagram in just a bit. The pulmonary artery divides into two, one artery to each lung, and this is the only artery that carries oxygen poor blood. All of the other arteries carry oxygen rich blood. This is the only exception. When passing through the lung capillaries, the blood absorbs the oxygen. This newly oxygenated blood returns to the heart through the pulmonary vein, and this is the only exception when the vein has oxygen-rich blood. Otherwise, all the veins in your body have oxygen-poor blood. The circulation of blood from the heart to the lungs and back to the heart is known as pulmonary circulation. O2, or oxygen-rich, the blood enters the left side of the heart through the pulmonary veins, and oxygen-rich blood leaves the left side of the heart through the aorta, leading to the entire body. The aorta. The aorta is the largest single artery in the body. Page 403 has a picture of the aorta and its arteries. The aorta, as it leaves the heart, moves up at first, and this is called the ascending aorta, but then it arches dorsally or towards the back and runs down just in front of the vertebral column. And where it runs down in front of the vertebral column is called the descending aorta. And those are both labeled for you in the diagram already. This aorta divides into numerous branches throughout your body called arteries that carry oxygenated blood to all parts of the body. We have the brachial artery, the axillary artery, the splenic, gastric, renal, carotid arteries. And these are all on page 403, figure 11.4. Arteries, if you think about it, when we take a pulse, we can take a pulse in the brachial in the arm, or the radial in the wrist, or the apical is listening to the heart. Arteries are where the point of impulse is at its greatest, and we can feel and or hear the heartbeat. Okay, also we can feel the pulse in the knees with the popliteal, and the dorsalis pedis artery and the posterior tibial artery. We can check for pulses in the feet when we're wondering about circulation. The anatomy of the heart. Vessels are very important, but the heart is the main organ of the cardiac system. It weighs a little less than 1 pound on average, and it's roughly the size of your fist. So if you make a fist, that's about how big your heart is. It lies in your thoracic cavity, and you know that means your chest cavity. IC is pertaining to, and thoraco means chest. And the heart consists of 4 chambers. We have 2 upper chambers, the atria, and 2 lower chambers, the ventricles. Actually, the heart is a double pump bound into one organ, and it's synchronized very carefully. We have two pump stations. Pump station 1 is the right side of the heart. And remember, when you're looking at a diagram of the heart, the right side of the heart is actually on your left side, and the left side of the heart is actually on your right side. You're looking at it as if it's in the anatomical position. So the right side of the heart is pump station 1. It sends oxygen-poor blood to the lungs, where it picks up oxygen and gets rid of the carbon dioxide from the tissues in the body. And then pump station 2 is the left side of the heart. And this forces oxygenated blood to all parts of the body. At the body tissues, the blood loses its oxygen, returns to the heart without oxygen, and starts anew. And this happens on average 60 to 80 times every minute. If you look at the diagram on 405, the right side of the heart is blue, and that's because that's the oxygen-poor blood. The left side of the heart is red, and that's the oxygen-rich blood. Let's label the diagram on page 405 together. Number 1 on the diagram is the superior vena cava. And this drains blood from the upper portion of the body, and it's receiving used blood or oxygen-poor blood from the upper half of the body. Number 2 is the inferior vena cava, and that carries blood from the lower portion of the body into the heart. So these are both veins, they're the largest veins, and they carry oxygen-poor blood into the right atrium. And that is number 3 on the diagram. The right atrium is the first chamber that's involved. It receives blood from the vena cava, the superior and inferior. The thin-walled upper right chamber of the heart is the right atrium. And when it receives the blood from the superior and inferior vena cava, it contracts to force blood through the tricuspid valve, and that's number 4. 3 is the right atrium, 4 is the tricuspid valve, into the right ventricle. And you can see the arrows on the diagram for us. It's coming from the vena cava into the right atrium through the tricuspid valve. And there's a little picture or a cutout that shows you the 3 flaps or the 3 cusps of this valve. So it goes through that valve, and the right ventricle contracts then to pump oxygen-poor blood through the pulmonary valve. And pulmonary valve on the diagram is number 5. No, I lied. Is number 6. I'm sorry, right ventricle is number 5. Number 6 is a pulmonary valve. The blood is still blue because it hasn't gone to the lungs yet. So 6 is a pulmonary valve. It then goes into the pulmonary artery. Before it goes to an artery, it has to go through a valve. So then it goes through number 7, the pulmonary artery. And while this is happening, while that ventricle is contracting, the tricuspid valve stays shut. So it opens up to let the blood go from the right atria to the right ventricle. When the right ventricle contracts to move it into the pulmonary valve, that tricuspid valve stays shut. If it didn't stay shut, or if there's something wrong with the valve, that blood, instead of going to the lungs where it can get rid of carbon dioxide and pick up oxygen, that blood would stay oxygen poor because the blood would just get pushed back up into the right atrium. The pulmonary artery, which was number 7, branches off to carry oxygen-deficient blood to each lung. There's a right and a left pulmonary artery, and that's number 7 on the diagram. So it leaves the heart through the pulmonary artery, goes to the lungs. It goes to the capillaries of the lung, picks up oxygen, you exhale carbon dioxide. Then that blood comes back to the heart through the pulmonary veins. And that's number 8 on the diagram. Pulmonary veins we have from the right and the left lungs. And through these veins, blood is brought back to the heart from the capillaries of the lungs. And that's number 7. I'm sorry, that's number 8. It comes back through these veins into the left atrium, and that's the upper chamber on the left side of the heart. And the pulmonary veins is where we went from blue to red color. So now we have oxygen-rich blood. So the left atrium receives this oxygen-rich blood through the pulmonary veins. And just like the right atrium, the walls of the atrium contract and they force it through the mitral valve. And the mitral valve is number 10 on the diagram. So 9 is the left atrium, 10 is the mitral valve. And you can see the difference of that valve compared to the tricuspid valve on the right. It goes through the mitral valve into the left ventricle, and that's number 11 on the diagram. If you look at the thickness of the wall of that ventricle, that muscle in that left ventricle is much thicker. It's on average 3 to 4 times thicker than the right ventricle. And that's because the right ventricle just has to push it hard enough to get to the lungs, which is in the same thoracic cavity, right? The left ventricle has to pump it so hard to get it to every single tissue in your body. It has to push it to that aorta so all the arteries get a chance at that oxygen-rich blood. So it needs to have a much tougher and stronger pumping mechanism. It propels blood through the aortic valve. The aortic valve is number 12 on the diagram. Into the aorta. The aorta is up at the top. It's number 13. And remember I said there's an ascending aorta and then the aortic arch and then the descending aorta. And this aorta then branches to carry blood to your entire body through all of the arteries. So what I'd like us to do now is to go ahead and turn to page 439 in your textbook. I'd like you to push pause now and take a few minutes to do letter A. And what that does is matches the structures with the descriptions, the 12 descriptions with the structures that are listed. And it has to do with what we just talked about. So I'll wait here. Go ahead and push pause and do that. And when you come back, we'll go through it. Okay, thanks. Okay, good. Now let's look at the numbers for letter A, and then we're going to do letter B together as a group. Number 1, the valve that lies between the right atrium and the right ventricle. That's the tricuspid valve. And a good way to remember that is we always try to do the right thing. So the tricuspid valve is on the right because we always try to do the right thing, or we should. Number 2, the smallest blood vessel, and that's the first thing that we talked about were the 3 blood vessels. And the smallest blood vessel is the capillary. And that's 1 endothelial cell thick. It's the smallest one. Number 3, carries oxygenated blood from the lungs to the heart. That would be the pulmonary vein. And the largest artery in the body, number 4, that's your aorta. Number 5, oxygen poor blood into the heart from the upper parts of the body. That's the superior vena cava. And superior means upper, so that makes sense. Number 6, the upper chambers of the heart are the atria. Atria is the plural, atrium is singular. And number 7, carries oxygen poor blood to the lungs from the heart. That's the pulmonary artery. Remember, arteries always carry away from the heart. Veins always carry into the heart. And number 8, a small artery. That would be an arteriole. OLE means little or small. And the valve that lies between the left atrium and the left ventricle, that's the mitral valve. You may also see the mitral valve called the bicuspid valve if you're an A&P or human body or body structure and function. Mitral valve and bicuspid valve are used interchangeably. Number 10, brings blood from the lower half of the body to the heart. That would be the inferior vena cava. Inferior means below or under. So that's the bottom half of the heart or of the body. And number 11, a small vein would be a venule. ULE also means little or small. And the lower chamber of the heart, number 12, that is the ventricle. All right, next we're going to trace the path of blood through the heart. We're going to begin as blood enters the right atrium from the vena cava, both the inferior and superior. And we're also going to include the valves, and they filled in a couple of these for us. So the right atrium is our starting point. The next stop, after the blood comes from the superior and inferior vena cava, after it goes to the right atrium, it has to go through the tricuspid valve. Remember, we try to do the right thing. Tricuspid valve stays shut, and it goes into the ventricles. As the ventricle contracts, the tricuspid valve stays closed over there, and then it goes into the pulmonary valve. Pulmonary valve then turns into the pulmonary artery. They've filled in number 6, it goes to the capillaries of the lung. Number 7 is when it comes from the lungs back to the heart. Those are the pulmonary veins. We have a left and a right pulmonary vein. And they both dump this oxygen-rich blood then into the left atrium. They have to go through a valve to get to the next section, and that valve is the mitral valve. It goes to the lower chamber then on the left side, and it goes to the left ventricle. And remember that mitral valve can also be called the bicuspid valve. The left ventricle then contracts, and it's the strongest of the 4 chambers of the heart because it has the biggest job to do as far as getting that blood pumped. So the left ventricle pumps, it goes through the aortic valve, it leads to the aorta, and then it leads to all of those arteries throughout the body. Okay, so right atrium, tricuspid valve, right ventricle, pulmonary valve, pulmonary artery, capillaries of the lung, pulmonary veins, left atrium, bicuspid or mitral valve, left ventricle, aortic valve, and then aorta. And I would know that flow of blood through the heart. You're going to need to know that for not just this class, but you'll need to know it for human body, A&P, advanced A&P, and body structure and function if you're taking those. So I would know that. You may see that on the test. So let's go ahead and turn back to page 406. And now we're going to talk about the walls of the heart and the pericardium. The 4 chambers of the heart are separated by partitions, and these partitions are called septa, or septum is plural. The interatrial septum is the septum or the wall that separates the 2 upper chambers of the heart. And if we take interatrial and break that word down, AL is pertaining to, surprise, surprise, inter means between, and atrio means atria, or the upper chambers. The interventricular septum is the wall that separates the 2 lower chambers of the heart, or the 2 ventricles. And these are all on page 406. Number 1 is the interatrial septum, and number 2 is the interventricular septums. 3, 4, and 5 are showing us the 3 layers of the heart. Number 3 is the yellow lining, and that's the endocardium. And this is a smooth layer of endothelial cells. It lines the inside of the heart as well as all of the valves. Number 4 is the myocardium, and that's the pink. And this is the middle muscular layer of the heart. It is the thickest layer, and at its very thickest is where it surrounds the left ventricle. And number 5, the blue, is the pericardium. It's a fibrous and membranous sac that surrounds the heart, and the pericardium has 2 layers. It has the visceral pericardium and the parietal pericardium. The visceral is closer to the heart, and the parietal is the outermost membrane, or the outermost layer of the pericardium. In between those 2 is a pericardial cavity, and this is where pericardial fluid circulates and keeps those layers from sticking together. Also on that diagram, they've labeled for us the bottom of the heart, that's the apex. The pointed end of any organ is always referred to as the apex. The broad end of an organ is referred to as the base. There is another pathway of blood through the heart on the bottom of page 406. And again, it's color-coded: blue for oxygen poor, red for oxygen rich. And that's just another way of, instead of listing it, they kind of diagram it and draw and map it out for us. Okay, so you can see in the capillaries is where it changes from blue to red. The next section of the book talks about the physiology of the heart, the heartbeat, and the heart sounds, and also the electrical conduction system of the heart. The heartbeat has two phases, and we call them diastole, which is the relaxation phase of the heart, and systole, which is the contraction of the heart, or when the heart is working. In diastole, the ventricle walls relax, and blood flows into the heart from the vena cava, the superior and inferior, the pulmonary veins. The tricuspid and mitral valves open as blood passes from the right and left atria into the ventricles. The pulmonary and aortic valves close during diastole. During systole, or the contraction, the walls of the right and left ventricles contract, pump blooding into the pulmonary artery and into the aorta. When this happens, the tricuspid and mitral valves are closed. They slap shut to prevent backflow of blood into the atria. So when you're listening to the lub-dub of the heartbeat, you're hearing the valves slap shut. And the closure of the valves is what we're listening to. The normal cycle of a heartbeat starts with the beginning of systole, or the contraction, and ends with the end of diastole, or relaxation. And any abnormal heart sound that we hear, either within the heartbeat or between heartbeats, is called a murmur. And typically murmurs have to do with a valve disorder. The conduction system of the heart. The heart begins beating in the embryo before the heart is even supplied with nerves. We don't know how. I think it's the 18th day after conception, we can see a heartbeat in an embryo. The responsibility for initiating or starting this heartbeat rests with a small region of specialized muscle tissue in the back portion of the right atrium, and this is where the electrical impulse originates, or where it all starts. This is known as your sinoatrial node, or the SA node. This is what we know as our pacemaker. When somebody needs to have a mechanical or an artificial pacemaker placed in their chest cavity, it's because this specialized bunch of cells in the right atrium are not firing properly for some reason. The electricity that's generated in the SA node causes the atria, the left and the right, to contract and force blood into the ventricles. And that's ending diastole, or the resting phase then. If you look on the diagram on 408, number 1 is the SA node. And you can see it's just kind of sitting posterior or behind the right atrium. So 1 is the SA node. And this electricity passes from this node to another region of myocardium at the posterior portion of the interatrial septum, so that wall between the right and left atria, called the AV node. And that stands for atrioventricular node. And that's number 2 on the diagram. The AV node immediately, as soon as it receives this electrical impulse, sends this excitation wave to a bundle of specialized muscle fibers called the AV bundle, or atrioventricular bundle, also known as the bundle of His. And that's number 3 on the diagram, AV bundle, or bundle of His. And that's named after the physician who discovered it. The bundle of His divides into right and left bundle branches. And these bundle branches form conduction myofibers that extend through the ventricular walls and stimulate them to contract. Number 4 is the left bundle branch. Number 5 is the right bundle branch. And these branches, you can see, they're almost like fingers that wrap around these ventricles. And when they receive that electrical impulse, it causes the ventricles to contract. When the ventricles contract, systole occurs and blood is pumped away from the heart. The right side of the heart pumps it to the lungs, left side of the heart pumps it to the body. I would know this for the test: SA node, AV node, bundle of His, right and left bundle branches, and Purkinje fibers or conduction myofibers. Okay, that's the electrical system or the electrical conduction system of your heart. EKG or ECG. They both stand for electrocardiogram. And this is a record that's used to detect the electrical changes in the heart muscle as the heart beats. The normal EKG shows 5 waves or deflections. And by deflection, we mean a movement from the baseline either up or down. Either one is a deflection. But each of these deflections represents electrical changes as a wave of excitation spreads through the heart. So when we're taking an EKG or recording an EKG, we're taking that electricity that's traveling through the heart and putting it on paper to look at the conduction system. And if you look on page 409 in your book, it shows these deflections or waves. We have the P wave, and that's always first. That's the atrial contraction. The QRS segment, or the QRS wave, you can see the negative deflection goes down, that's the Q. The tallest positive deflection is the R, and then the S is another negative. That's the ventricles contracting. And then the T wave is the ventricles resting or getting ready to go again. So PQRST is normal sinus rhythm. P wave is the atria, QRS, like we just talked about, was the ventricles, and the T wave is recovery and relaxation of the ventricles. The normal heart rhythm is called sinus rhythm. Sympathetic nerves speed up the heart rate during conditions of emotional stress or when you're exercising. And the parasympathetic, and we just talked about both of these last week, is when nerves slow things down when there's no need for extra pumping. So sympathetic speeds up, parasympathetic slows things down. The blood pressure is the force or the amount of pressure the blood exerts on the arterial walls. We measure a blood pressure with a tool, and the tool is a sphygmomanometer. If we break that word down, meter means instrument to measure. Sphygmo means pulse, and we'll get to that later tonight. And then mano means to manual or to manually measure. And with a sphygmomanometer, we use our hand to manually pump up that cuff to get a blood pressure reading. And typically your blood pressure is expressed as a fraction. The top number on that fraction is systole, or the pressure when the heart is beating, and the bottom number is diastole, or the pressure in the arteries as the heart is resting. And there's a picture of a sphygmomanometer on page 409. And we use the brachial artery to measure a blood pressure. All right, let's turn to page 411. Ignore those pages, they're the wrong numbers, but 411 is where our word parts begin for this unit. We've had some of these already, but some are new. If you want to look at 411, the first one is angio, and angio is vessel. So an angiogram, if we think back to chapter 1, gram means record. So an angiogram is a record of a vessel. Angioplasty is surgical repair of a vessel. Aorto is an easy one. It means aorta. Aortic stenosis is abnormal narrowing of the aorta. Osis means abnormal. Steno means narrowing. Arterio and artero both mean artery. Arteriosclerosis is abnormal buildup of fat of an artery. Arterial anastomosis is a new opening between arteries. Arteriography is a process of recording arteries. And endarterectomy, ectomy means removal of, endo means within, so we're removing the inner lining of an artery. If somebody has plaque or fat that is still soft in an artery, we can go in and perform an endarterectomy where we scrape that fat. The next page, athero means yellow plaque or a fatty substance. So an atheroma is a tumor of yellow fat or a tumor of a fatty substance. Atherosclerosis means hardening of the artery because of fatty plaque or fat material. And an atherectomy would be a removal of the fatty plaque. Atrio makes sense. It means atrium, or the upper heart chamber. Atrial is pertaining to the atrium. Atrioventricular is pertaining to the atria and the ventricle. Brachial means arm. And if you think of the brachial artery, it's at the bend of the elbow. So brachial artery is the artery in the arm. We've had cardio before. That was in our very first chapter back in August. Cardio is heart. So cardiomegaly, the suffix megaly means large. So cardiomegaly is enlargement of the heart. Cardiomyopathy, break that word down. Pathy is disease. Cardio is heart. And don't forget there's another combining form, myo. So it's disease of the heart muscle. Bradycardia, remember the Brady kids were a little slow, so slow heart rate. And typically it's less than 60 beats a minute is termed bradycardia. And then tachycardia is fast. Tachy means fast. So anything over 100 is considered tachycardia. Cardiogenic shock is shock that's produced by the heart. And this results when the heart fails to pump adequate blood supply to the body, so the body goes into shock caused by the heart being ineffective. Cholesterol means cholesterol, which is also a fatty substance. Hypercholesterolemia, a big word that means high cholesterol. Emia means blood condition. Hyper means excessive or above, so excessive cholesterol in the blood. Coronal, like cardio means heart. You can put those on the same card. Coronary arteries are the arteries that pertain to the heart. They're the arteries that supply the heart with blood. I think we've had cyano, it means blue. Cyanosis means abnormal condition of blue. Myxo means mucus. Myxoma is a tumor of mucus. And a myxoma is a benign tumor. They occur most frequently for some reason in the left atrium. Oxo means oxygen. So hypoxia means IA is state of. Hypo means below or insufficient, so a state of or with insufficient oxygen. Pericardio means pericardium, that double membrane sac around the heart. So a pericardiocentesis is a surgical puncture to remove fluid from the pericardium. Flebo, like veno, means vein. You can put those on the same card. We'll have veno on the next page, I think. Yes, and veni. Flebo, veno, and veni all mean vein. Phlebotomy is a word. Tomi means to cut. So in phlebotomy, we are cutting a vein. Thrombophlebitis. Itis is inflammation. Thrombo means clot. So thrombophlebitis is inflammation. of the vein because of a clot. Rhythmo means rhythm. Arrhythmia means condition of or state of no rhythm. Okay, when the heart is not beating, it's an arrhythmia. Okay, a dysrhythmia is also used to describe an abnormal heart rhythm, but arrhythmia usually means that there is no heartbeat. Sphygmo means pulse. A sphygmomanometer means an instrument used to manually measure the pulse. Stetho means chest. We've had thoraco for chest. Stetho also means chest. A stethoscope, one of those words that really doesn't make sense because scope means an instrument to examine, and we're not examining the chest with a stethoscope, but we're listening to it. But in the end, stethoscope means instrument to examine the chest. Thrombo, we've had that. That means clot. Thrombolysis is to break down or destroy the clot. Valvulo and valvo both mean valve. Valvuloplasty is surgical repair of a valve. Mitral valvulitis is inflammation of the mitral valve, that valve between the left atria and ventricle. Commonly associated with rheumatic fever, an inflammatory disease caused by inadequate treatment of strep throat. When you get 10 days of antibiotics, or 5 days if it's the Z-Pak or azithromycin, take the full dose of medication. If you don't, the strep can linger, and it doesn't stay in your throat, it travels, and it likes that, for some reason, it likes that mitral valve or bicuspid valve in your heart. A valvotomy would be to cut into a valve. Vaso means vessel. Vasoconstriction means constricting or narrowing of a vessel. Angio and vaso both mean vessel. You could put those on the same card. We also had vaso in the male reproductive for vessel as well. And specifically there it meant vas deferens. Vasodilation means just the opposite. It's widening or dilating of a vessel. Vasculo also means vessel. So vascular means pertaining to a vessel. Veno, veni, and flebo that we already had means vein. So venous means pertaining to a vein. And venipuncture means to puncture a vein. Ventriculo means ventricle or one of the lower heart chambers. Interventricular septum is the wall that separates the left and right ventricles. All right. Next, we are going to look at some diseases of the heart, and we look at the heart and the blood vessels first on page 414. All of these are important and interesting, but there are a few that I want you to look at for the test. For the heart, mark arrhythmias, abnormal heart rhythms, and also called dysrhythmias. When the rhythm isn't a normal sinus rhythm, it's called an arrhythmia or dysrhythmia. Also mark bradycardia and heart block. This is known as AV block. AV block is failure of proper conduction of impulses from the SA node through the AV node to the atrioventricular bundle of His, and that's called a heart block. 416, mark flutter, and that's a rapid but regular contraction, usually of the upper chambers or the atria. With flutter, it may reach up to 300 beats a minute. It's often is symptomatic of heart disease and frequently requires treatment, such as medication, electrical cardioversion, where we shock the heart back into a regular rhythm. Or if we know what part of the heart or what tissues are causing this arrhythmia or dysrhythmia, they can go in and do an ablation, where they get rid of some of that tissue so the heart behaves. So flutter is rapid but regular contractions. Fibrillation, mark that one, that's very rapid, random, inefficient and irregular. So of the two, fibrillation is much more serious. They both are serious, but fibrillation is more likely to lead to death. The fibrillation, the heart beats 350 beats a minute or more. And atrial fib is the most common type of cardiac arrhythmia. Ventricular fibrillation is the only one that your defibrillator will fix. The only thing the defib will work on is VFib, when the ventricles are just kind of quivering when they stop contracting. Okay, so flutter is rapid but regular. Fibrillation is random, rapid, and inefficient. Page 418, mark septal defects. If you think of the septum, they're the walls that separate the atria and ventricles. So septal defects would be any defect in those walls, or holes in the walls, or something that doesn't separate the atria and or the ventricles from each other. CHF on page 419, congestive heart failure. This is when the heart is unable to or fails to pump the required amount of blood. CAD is coronary artery disease, and this is the disease of the arteries that surround the heart. And those coronary arteries kind of wrap around the heart like a crown. That's where we get coronal, it means crown. So it's a disease of the arteries that supply blood to the heart tissue. Page 422, I want you to mark endocarditis. And because you know the word parts, you know that's inflammation of the inner lining of the heart. MVP isn't most valuable player, it is mitral valve prolapse. Improper closure of the mitral valve, and that's the valve on the left side of the heart between the atria and ventricles. Pericarditis, mark that one at the bottom of 422. Inflammation of the membrane or the pericardium that surrounds the heart. Page 423, mark aneurysm. And an aneurysm is a widening or dilation of an arterial wall. When the arterial wall, or when an artery widens or dilates, what it does to that wall is it makes it thinner. And when it gets thin, it gets weak. And when the wall is weak and is still receiving that great surge of blood every time the heart beats, it can result in bleeding. So an aneurysm is a local widening of an arterial wall. It is a medical emergency when it gets very thin. If you look at the picture on 423, that's what we refer to as a AAA, an abdominal aortic aneurysm. We have the aorta that comes down in front of the vertebral spine, and it goes all the way down to the groin where it branches off again. You can see that it should be nice and straight there, but it's not, that those walls are weak and they're widening. What we have to do is we have to put a stent or a graft around it, and what that will do is it will hold that vessel together so the walls don't get so weak that the patient bleeds out. So that's an aneurysm. The next page, DVT, deep vein thrombosis. A blood clot forms in a large vein, typically because gravity is not always our friend, it's in one of the lower limbs, in the legs. Typically the calf is where we see often DVTs. Hypertension, or HTN, that's high blood pressure. And we typically say 120/80 is average. Anything above 140/90 is categorized as hypertension or high blood pressure. And in pharmacology, you'll learn what we do to treat high blood pressure. 424 at the bottom, varicose veins, mark that one. Abnormally swollen and twisted veins, usually occurring in the legs. It's caused by the valves in the veins that stop working. So instead of keeping that blood flowing in one direction, as we get old and as we're on our feet a lot, sometimes those valves start to not do their job, and then blood pools there because it's not being pushed to go in the right direction. And when blood pools there, the vein expands a little bit, and then it bubbles a little more, and then we can see them through the surface of the skin. Okay, picture a drawing of that on 425, the normal vein keeping the blood flowing in the right direction. In the lower picture, the varicose vein, it doesn't keep flowing in the right direction. It starts to regurgitate or go back down, therefore protruditing the veins. And that's what varicose veins can look like in the legs, letter B. And letter C is varicose veins, but also with a thrombophlebitis, or inflammation of the vein because of a clot. And that too is something that we usually have to put somebody in a hospital on complete bed rest until we get that clot dissolved. And we use warfarin or Coumadin or heparin to dissolve the clots. We don't want it to move anywhere or go to the heart or go to the lungs or go to the brain, because patient could have a stroke or a pulmonary embolism or a heart attack if those clots get feet and start to move, and then they're called an embolism. Just some lab to look at on 427, marked cardiac biomarkers. And these are what we call cardiac enzymes. These are chemicals that are measured in the blood as evidence of a heart attack. If you've ever heard of somebody who's gone into the hospital and they had these symptoms and they put on the EKG and it didn't look right, but we don't know if they had a heart attack for sure or not, but we're going to do some labs, and in a few hours we'll know for sure. These cardiac enzymes are what tell us what happened to that tissue. You don't have to know the troponin I, the troponin T. You don't have to know the C-reactive protein and all of those, but know that cardiac enzymes are elevated when the cardiac tissue is damaged. And they elevate pretty quickly within hours after an infarct or a heart attack. Lipid test or lipid profile. This is measuring the amount of fat in the blood or cholesterol. HDL is the happy cholesterol or the happy fats. It's what keeps us healthy. LDL is the not good fats, and that's what clogs our arteries and makes us unhealthy. Total cholesterol is a total, and usually we like to see that below 200. Some physicians or for some categories of people are a little different, but typically a less than 200 is a good amount. We want the HDL a little higher and the LDL a little lower. How do we get those separate numbers? Is lipoprotein electrophoresis. We take that cholesterol and separate it into the good and bad fats. The bad fats sink down lower in the specimen, the good fats rise up. So that's how we can break that down. Page 428, Doppler ultrasound studies, mark that one. This is when we're listening to sound waves to measure blood flow within the blood vessels. We use the same Doppler that we use in OB for prenatal women when we're listening to baby's heart rate. We'll use that same piece of equipment to listen to and measure circulation in lower extremities, legs, ankles, feet, maybe behind the knee. It's the same thing. We're listening for the flow of blood. An echo on page 429. It's an echocardiography, and we abbreviate that or call that an echo. This is echoes generated by high-frequency sound waves produce the images of the heart. So it's almost like a really fancy ultrasound of the heart. Okay, we put the transducer into the esophagus, and we use that transducer down in the esophagus behind the heart to pick up the picture, pick up the images. And there's a picture, letter B, of the procedure and letter A of an echocardiogram or that record. And you can see the 4 chambers there and the septal walls between them. Cardiac catheterization, mark that one. A thin flexible tube is guided into the heart either through a vein or an artery. And electrocardiography, we talked about that already in EKG. And there's a picture of cardiac catheterization on the bottom of page 430. You were continuously monitoring a patient's heart rhythm. Sinus rhythm begins in the SA node, and the normal rate is between 60 and 100. That's for the electrocardiogram. sorry about that. The catheterization, you can see we're going in the groin, the inguinal artery. We're going up the aorta, up the ascending, descending aorta into the heart, into the left ventricle. Okay, and when we're doing this cardiac catheterization, we want to see what's blocked where. Holter monitoring is an EKG that somebody wears for a full day or 24 hours to detect cardiac arrhythmias. So if a patient comes in and they're having symptoms and the EKG looks fine, but they're still having symptoms, and the doctor can order for them to wear one of these home and come back the next day. And there's usually a button they can push, so when they feel symptomatic, the physician can look exactly at what's going on in that cardiac tissue at that very moment and see why they're feeling their symptoms. And then a stress test is when we put them on a treadmill and we have them exercise, and that's called an exercise tolerance test sometimes, or ETT. We have them walk at a certain rate of speed, at a certain incline, and we see how hard the heart is working and how the heart is responding to that stress or to that exercise. Page 432, coronary artery bypass grafting, and we abbreviate that CABG. Arteries and veins are anastomosed or reconnected together to detour around a blockage. Defibrillation is a brief discharge of electricity applied to the outside of the chest to stop dysrhythmias, or VFib, and that's the only one defibrillation will work on. And your defibrillators are programmed to only shock if it is in VFib. Otherwise, it'll say shock not advised, resume CPR. Page 433, mark percutaneous coronary intervention, or PCI. And that's when we take a balloon tip catheter into a coronary artery, one of those arteries surrounding the heart, and we open the artery. We can put stents in place to keep that plaque or to keep that fatty material away from the center so blood flow is not interrupted. And if you look on the bottom of 433, we have a picture of that. You can see that atherosclerotic plaque that's blocking the vessel mostly. We put the stent in, we put it closed. It's like when you have an umbrella that's closed. We put it in the artery, we open the umbrella or we open the stent, it's inflated with the balloon. We take the balloon out, the stent or that mesh stays in there, and hopefully, if it does what we want it to do, it keeps that atherosclerotic plaque off to the side so blood flow is maintained. All right, let's turn to page 437, and there is a clinical case. What's your diagnosis on there? There is 3 cases, the 24-year-old woman, Mr. Smith is number 2, and then a 42-year-old female is number 3. I'm going to have you push pause and go ahead and read through these. They're very brief. They're not even a paragraph each. And then following them, there's one or 2 or 3 questions. And when you come back or when you put unpause or push play, we'll go through the answers. Okay, so let's go through these case studies and see what you came up with. Number 1 is a 24-year-old woman with a history of palpitations. Heartbeat unusually strong, rapid, or irregular, so the patient feels it. And a vague chest pain, enters the hospital. With the patient supine, so laying on her back, you hear a mid-systolic click that's followed by a grade 3 out of 6. Moderately loud is 6 out of 6, and 1 out of 6 is fairly quiet. So you can hear it. A honking murmur. Your diagnosis is, we can't diagnose as nurses or MAs, but the diagnosis that will probably come from this is, letter B, mitral valve prolapse. Okay? Remember I said anytime there's an extra heart sound or a murmur, it's typically because of a valve. Number 2, Mr. Smith was admitted to the telemetry unit for cardiac monitoring after an episode of chest pain. His cardiac enzymes, that lab test we talked about, and they give us the troponin T and troponin 1, were slightly elevated, and the EKG showed elevation in the ST segment. An angiogram, so a record of the vessels, reveals plaque blocking the left artery device. PCI and DES is recommended. What did the EKG reveal? And you would pick D, STEMI. ST elevation indicative of myocardial infarction. So 1 is D. Number 2, the diagnosis for the patient would be a heart attack, letter A. Another word for heart attack is myocardial infarction. And then what treatment was recommended at the very end? Catheterization with a drug-eluting stent placement. Those little mesh screens or stents that we put in, some of them are impregnated with drugs that keep the blood thin, so it prevents clotting as well. So 1 is D, 2 is A, 3 is B. Our last case is a 42-year-old female runner recovering from an upper respiratory infection, comes to the ED complaining of chest pain that is sharp and constant, worse when she is lying down, and decreased with sitting up and leaning forward. Serum troponin levels rule out an acute MI, so the cardiac enzymes were normal. The ED physician auscultates a pericardial friction rub. Remember I said that in that pericardial cavity or between the 2 layers, there's fluid. If there's an irritation or an inflammation, you'll hear a rubbing sound on auscultation. So what's the diagnosis for this patient? The best choice there would be D, pericarditis, or inflammation of the pericardium. And the danger of this condition to the risk is a risk for progression to, and this isn't one of the diseases that we talked about or I had you mark, but it's cardiac tamponade, where the pressure in the pericardium almost squeezes the heart, and then it interferes with heart functioning and leads to heart failure. But the correct answer for that would be A. Okay, so why don't we look at our pronunciation at the very end, and this is on page 451. So why don't we go through these terms, okay? And a lot of them are pretty basic, but let's just go through them using the pronunciation guide. And I'll go through them and you can repeat after me if you like, or you can just listen. It's up to you. So 451 starts with angiogram, angioplasty, anoxia, aorta, aortic stenosis, apex of the heart, arrhythmia, arterial anastomosis, arteriography, arteriole, arteriosclerosis, artery, atherectomy, atheroma, atherosclerosis, atrial, atrioventricular bundle, atrioventricular node, atrium, brachial artery, bradycardia, bundle of His, capillary, carbon dioxide, cardiogenic shock, cardiomegaly, cardiomyopathy, coronary arteries, cyanosis, deoxygenated blood, diastole, electrocardiogram, endocardium, endothelium, hypercholesterolemia, hypoxia, interventricular septum, mitral valve, mitral valvulitis, myocardium, myxoma, normal sinus rhythm, oxygen, pacemaker, pericardiocentesis, pericardium, phlebotomy, pulmonary artery, pulmonary circulation, pulmonary valve, and pulmonary vein. Pulse, septum, sinoatrial node, sphygmomanometer, stethoscope, systemic circulation, systole, tachycardia, thrombolysis, thrombophlebitis, tricuspid valve, valve, valvotomy, valvuloplasty, vascular, vasoconstriction, vasodilation, vein, vena cava or vena cavae, venipuncture, venous, ventricle, venule. And I am going to stop there because the rest of them, we only took some of those diseases and lab tests and clinical procedures. I didn't choose all of those. So I'm going to stop there. Work on your word parts for this and work on those diseases and labs and procedures that we talked about. Know the flow of blood through the heart, starting with the vena cava to the right atrium, tricuspid valve, right ventricle, pulmonary valve, pulmonary artery, pulmonary veins, left atria, bicuspid or mitral valve, left ventricle, aortic valve, aorta to the body. Also know the conduction system through the heart, the SA to the AV to bundle of His, Purkinje fibers, bundle of His, left and right bundle branches and Purkinje fibers or conduction myofibers. Know those for the test too. Your test will be available to you at the specified time on the sheets that I gave you. If you have any questions, you can call me or email me or text me. I'm available to you whenever. If you have any questions about how to test, if you're not used to testing online, if you're used to doing it as a group and you have questions, please let me know. Otherwise, those of you who are at night, you've been doing this, so you know how that all works. And thank you for your time, and I'll see you next time. All right, thank you.